easier to pay attention when you don't have the report. I'm sorry.
So for the butt model, you will have, and I'll have to check because I don't remember if we have the order in here or not. Sometimes at your facilities, you will have an order for the enema, and sometimes you won't. So the Foley catheter is in here. Yep, the enema is in here. So it's a tap water enema, 750 to 1,000 milliliters PRN for constipation. And then it also has a colostomy care, so your ostomy care order is on here as well. So did everybody just hear what I just said?
No, I'm sorry.
Ostomy care orders in there also.
Some facilities will have your enema order on your physician's orders, and some won't. So you have to know the policy of wherever you're at. Ostomy care, if they have an ostomy, it's kind of expected. Sometimes they have to put the order in the chart just because if they don't, then Medicare won't pay for the supplies. So it depends on where you're at and what you're doing. So you always want to start with the patient. So metatarsal 9, 6/21/1988, no known allergies. So you're coming to look, and right now we're just doing the enema. So tap water enema, 750 to 1,000 milliliters PRN for constipation. So you're going to gather your equipment and wash your hands, and you're going to go into your patient's room. The first thing you want to do is make sure that the patient is positioned correctly, which is what for an enema?
On their side.
What side? Left Sims position.
Yeah.
Right legs up and over. I would highly recommend that you take 2 people in when you're doing an enema because the patient's going to be very, very uncomfortable. So you're going to verify your patient. This is not on the MAR. Okay, I looked at the physician's orders when I looked at that. It's not on the MAR, so you have nothing to take in with you. You may want to grab just a label if you want to put that on your supplies so you can verify your patient. But you will not have anything other than that to bring in the patient's room. We will have this hooked up or over the sink while you guys are doing this because it will actually drain. So we will not have this in the bed at all. We'll have this hooked up over here. But I just want to see that you're making sure you verify your patient. And how would you explain this? Well, you guys haven't done the video yet, just you. So you're going to explain to the patient that they're constipated and their physician is giving them a tap water enema to hopefully get things moving so that they have a bowel movement. Constipation is very painful. We'll talk about that on Friday. So what you want to do, tap water enema, you're going to fill this bag. When you guys go through the video, it'll tell you how hot the water needs to be. You'll have to mix it with, if it's a soap suds enema, you'll have to mix it with the soap suds. Tap water enema, you're going to mix it with the tepid water. We have a thermometer, so you're going to tell me how much or how hot it's going to be. Normally what I do is I put it inside a graduated cylinder and then I will transfer it over to the enema bag. This enema bag will actually be in a wrapper and it will already be pre-lubricated. Because this is been used so many times, it's not lubricated, but normally you would have pre-lubrication on here. So you're going to go in your patient's room, position them on their left side, again bring somebody in. If you feel that it'll splash on you, you wear a gown. That's the other thing I wanted to tell you about the enteral feedings. Remember, if you think you're going to get splashed on, goggles, gown, and gloves. So you want to protect yourself. So same thing for this. If you think it's going to come back out rapidly, wear goggles, wear a gown, wear gloves. Protect yourself. So what you're going to do, and normally we have a smaller hanger. I'll try to find it so that we can bring it in the room. Because you want to hang this between 12 and 18 inches when you're giving it. You're going to have the patient relax as much as he possibly can. Pretend like I have my PPE on. You're going to go in about 4 inches. And this one is a little bit hard. I'll actually put water in it so you guys can see. I don't think this will get as hot as what they're. It's going to have a hard time reading it. They got the sticker right over it. Okay, 750. Okay, it looks like it's 750 to me. A little bit more. Well, those aren't draining very well. Alright, at 750. So normally at this point you'd also take the temperature of it. When you're putting the fluid in, make sure you clamp this. Otherwise you will have a hot mess. So we're going to open this up. Put our fluid in here. hold on to it because it is a lot of fluid. And I'm just pinching it to open it up. I don't know if you guys can see that or not.
I can hold it.
That'd be great. So then while you're preparing this, you're going to go ahead and open this up just so that you get enough fluid through the tubing. Once it goes through the tubing, you want to clamp it. Make sure you put that cap back on. So now we walked into our patient's room, we identified our patient, we positioned our patient, we have our PPE on. What you're going to do is you're going to go in about 4 inches. You want to make sure you're past that rectal sphincter, so you may have to twist it. And this mannequin is kind of hard to put in anyway. Let me put some extra lube on here. You can always take some extra lube in the room just in case you think you might need it. And I would never just take it out of the tube like that.
Or take it out the button and put it on the tube.
Yeah, exactly. Exactly. So you're going to try to push this in as best as you can. It will go in. You have to make sure that the holes are in for sure.
Mm-hmm.
This needs to go in further, otherwise it's just going to come right back out. And trust me, it is hard to get this in here. Normally you'd go just straight in.
No, and a person that's not that hard.
Yeah, this is just a mannequin, but once you get it in, you'll know. There we go. So you're going to go in 4 inches, and then what you're going to do is you're going to unclamp this and let it go in. Now you can adjust the speed of how fast this goes in by how high you hold it up. But again, you want it between 12 and 18 inches. If the patient should start to complain of pain, stop it immediately. Let the patient catch his breath, have him relax, lower the bag, and then continue to give it. You want to wait just a couple of minutes till all the cramping is passed, because the whole idea is to get the cramping going. Get the cramping going, you're going to get a bowel movement, hopefully. And then they have to retain this, and we'll talk about different types and times for retention. I'm just going to hold this up higher just so it goes in faster.
Here, I can do it, Chris.
And if you don't have this in far enough, it's going to leak out the patient all over the chucks. Okay, so once it's in, again, clamp it, wait about 10 to 15 seconds, have the patient relax as much as possible, withdraw, and it's not this hard on a real person, trust me. And then this will go in the trash. Some of the things that I like to keep at the bedside is a bedpan, in case they can't hold it for the length of time they need to, or a bedside commode if they can get up to the bedside commode. So I will have those right at the bedside. And then you're checking your patient frequently, and then again, we'll talk about retention, how long they need to retain. Do you have any questions, Mary, before you go? Because everybody else can ask me. I'm trying to go through this fast, so I apologize. Because I want to make sure the little one's okay.
No, I don't think.
All right, stomas.